Well, good afternoon, everyone. Welcome to today's Making Connections webinar hosted by REL Midwest and REL Southwest. My name is Bree Martin, and I am the Bridge Event Coordinator for REL Midwest. This afternoon's webinar will be focused on strategies for building early childhood data systems. And before we get started, I'd like to begin with a brief overview of the Regional Educational Laboratory Program and tell you a little bit more about who we are and what we do. REL Midwest and REL Southwest are part of a network of 10 regional educational laboratories funded by the U.S. Department of Education's Institute of Education Sciences, or IES. Based in the Chicago area, REL Midwest serves the educational needs of Illinois, Indiana, Iowa, Michigan, Minnesota, Ohio, and Wisconsin, and is administered by the American Institutes for Research. REL Southwest is based in Austin, Texas, and is operated by CEDL. REL Southwest serves the educational needs of Arkansas, Louisiana, New Mexico, Oklahoma, and Texas.
I'm back on.
The charge of both REL Midwest and REL Southwest is to improve academic outcomes for students by helping states, school districts, and schools systematically use data, conducting and supporting high-quality research and evaluation, and promoting evidence-based decision-making. In other words, REL Midwest and REL Southwest help educators and policymakers expand their knowledge and understanding of research and its value to decision-making and education reform. Both REL Midwest and REL Southwest conduct our work through research alliances, which bring together practitioners, policymakers, researchers, and others to collaborate and use data and research evidence to examine and address high-priority regional needs. REL Midwest currently has 8 active research alliances related to our region's 4 priority areas of college and career readiness, early childhood education, educator effectiveness, and low-performing schools and school improvement. Today's event was developed in collaboration with the REL Midwest Early Childhood Research Alliance. With that, I'll turn it over to my colleague from REL Southwest, Ece Garcia, who will tell us a bit more about REL Southwest and the features of today's webinar.
Good afternoon. I am Ece Garcia with REL Southwest, as Bree Martin just mentioned. And REL Southwest, like REL Midwest, has research alliances. Right now we have 6 research alliances. And different from REL Midwest, all of our research alliances are state-based. You can see the list here focused on different areas such as pre-kindergarten and charter schools, achievement gap, and Hispanic STEM. Today's event was done in part with the Arkansas Pre-Kindergarten Research Alliance. For more information on REL Midwest or REL Southwest, you can visit either of our websites to find links to resources and publications, more information about our research alliances and members, information about other upcoming events, both webinar and in person, access to our archived events, and you can also find more information about all of these resources by following us on Twitter at REL Midwest and at REL Southwest. One of the things I wanted to cover today before we get started are the webinar features. So you can see in your webinar platform that we have multiple chat pods. These chat pods will allow you to communicate with the presenters and with the technical team focused on the webinar. So you can type your message or question into the narrow rectangular box at the bottom of the chat pod, and then either click the dialog bubble or hit your return key to post the message. We have 3 different chat pods for you today. The first is a technical assistance chat pod. So if you're having any trouble regarding sound, or if you would like more information about the webinar tools or other technical concerns, please type your message there, and that will allow us to address your technical concerns immediately. We also have a Q&A chat pod. If you post your questions for the presenters here, then we will be able to easily identify the questions during the question and answer session. And the last chat pod is the Comments and Insights pod. So if you have comments or stories or various insights that you'd like to share with the presenters or your colleagues who are also on the webinar, please feel free to type that into that chat pod. Next, I would like to introduce our moderator for this afternoon, Ebony Howard. Dr. Howard is a managing director and the early childhood specialist at AIR. She oversees AIR's early childhood practice area. Howard has over 20 years of experience conducting child and family research as well as program administration and management. She has provided research or consultation services to federal, state, and local organizations. Dr. Howard is currently the director of 2 federally funded projects related to the professional development of early childhood teachers and a senior advisor on several national, state, and local early childhood research and technical assistance. She also serves as the Early Childhood Research Alliance lead for REL Midwest. I will now turn the webinar over to Ebony to tell us more about today's presentation.
You are no longer muted. All guests have been muted. You can unmute your line by pressing *6.
Hi, this is Ebony Howard. Thank you for that. We just wanted to make sure everybody's phones are muted, and we're really excited by today's agenda. As you can see here, we have 3 great presentations that we'll be talking about the using early childhood data and how we can move the field forward in that area. We'll have time for every presentation to go through, and we'll also have plenty of time for facilitating questions and answers from the audience. So as you have a question, please do use the chat box that you see there to ask any questions that come up, and we'll have time after the presentations to address them. One of the first things we wanted to do is just get a sense of who is on the call, and as many people might see as everybody is introducing themselves in the chat box below there are a lot of different folks from different regions around the country joining us for the call. If you could all just take a moment and go ahead and see what category of staff best fits for your current role, which of the following best describes your current role, and then complete. So as I get to see some of the data lively coming in, I see many people are from state education agency staff, but also school and district administrators, and many researchers also on the call. Another question we would like to know is just to get a sense of why you were on the call and what things you're interested in. So the next poll question is, how would you like to use early childhood data in your current role? Please take a moment to select the best that applies for you. Well, early results coming in, it seems like some of the top contenders here is to integrate data or coordinate services across multiple agencies, also to assess program performance, and to provide instructional support in the classroom. And these are some of the topics that I know many of our presenters will touch on in their presentations today. So without any further ado, let me introduce the first presenter. Carlise King is the Executive Director for the Early Childhood Data Collaborative, a partnership of national organizations working to support state policymakers in the development and use of coordinated state early care and education data systems. Ms. King has more than 13 years of experience conducting research on early childhood issues and examining the impact of state and federal policies on parents' access to child care services, licensed child care supply, child care costs, and the child care workforce.
Ms. King holds a Bachelor's of Art in Psychology from University of California at Berkeley and a Master's of Art in Social Psychology from San Francisco State University. Ms. King.
Thank you, Ebony. Hopefully everyone can hear me all right. So today I've been invited to share with you the results from our 2013 State of States Early Childhood Data Systems. I first just want to take a brief moment to talk about the Early Childhood Data Collaborative, and then go in to just give you an overview of the results from our survey that was really focused on getting a sense of where states are and how many states are currently linking child-level data across their early childhood data systems and with other systems. And then, as was mentioned before, we'll have a few minutes after the presentation to respond to some questions. So first, I just wanted to talk a little bit about the Early Childhood Data Collaborative. As Ebony had mentioned, we're a partnership of 7 national organizations. We were established in 2009, and our mission is really to promote practices and policies to help support not only the development, but also the use of longitudinal early childhood data systems. Understanding that the evolution of early childhood programs has really resulted from a configuration of programs from state to state, ECDC created a framework for developing coordinated data systems with the goal of really helping states transform their data systems that have been traditionally used to collect information around compliance for specific programs, but transforming that data into systems where they can really use it for improvement-driven data systems. So information to inform the work that you've been doing, but also data that can be used to inform future policies and practices. Currently, states have very fragmented data systems and where each one is siloed, documenting separate information on different programs. And so what we're trying to do is examine policies that really help states move from those fragmented systems into more of a coordinated system. And I'll go into a little bit more detail about how states may be doing that. And then in addition to coordinating data about current services that children are receiving, we're really focused on making sure that states have the opportunity to not just get a snapshot of what services children are currently receiving, but really being able to use the data to look longitudinally so that we can examine not just what's currently happening, but trends that are happening over time based on children's participation in different programs and different services. So in framing our survey and also a lot of our work, we really began with these 6 key policy questions. Through a stakeholder process, we talked to several state and national organizations around what types of questions should early childhood systems be able to answer. And so for these, first, what we identified are these 6 questions that really identify questions at the child, program, and then also workforce level. And whether or not states can answer how if children are on track to succeed when they enter school, which children have access to high-quality early childhood programs, what is the quality of those programs, and a lot of states have quality improvement initiatives, but do we have the data to be able to know if the quality of these programs are improving over time, and if there are specific characteristics that are associated with effective programs. And in looking at quality improvement initiatives that are happening statewide and nationally, a lot of states are specifically focused on the workforce. And so having data about whether or not the current workforce is prepared to meet different policies or standards that are being developed, and then also whether or not policy investments that are really focused on increasing the skills and qualifications of the early childhood workforce or addressing issues around retention, whether or not those policies and those initiatives are having the impact that are intended. So we began with these key questions, and because obviously states have different questions that they're going to want to address, but the feeling of the stakeholder group that we had met with was really, these are 6 key questions that state early childhood data systems should be able to answer and address. And so the second piece that we focused in on, so in order to address these questions, what are the key components that a coordinated early childhood data system must have? And that led us to develop the 10 fundamentals. And so I'm going to spend a little bit of time on a particular slide, mainly because the questions and also the fundamentals are how we focused and determine what types of questions that we were going to ask for our survey, which I'm going to be going over with you next. So to be able to answer the key policy questions that I've outlined, state systems really need the ability to connect child program and workforce level data to understand how children and programs and practitioners are progressing over time. So in order to know if children have access to high-quality early learning programs, states need to be able to connect data about children, what programs they're participating in, and then what are the structural quality and other characteristics of those programs. So that's just one example. So you'll see in the fundamentals, we've identified first what components at the child program and workforce level a coordinated system would need. And so one of the first components is really that states have a method for identifying unique children programs and staff participating in those programs. The next level is collecting participation characteristics of children that are participating in these programs, the characteristics, and I'm moving across on the slide right here. They're not going in number order. And then the qualifications and the experience of staff. And then also for children, really in order to answer that first question about if children are entering school ready to succeed or how children are progressing over time, having child development data that can be used to understand how children are progressing and how changes in services or workforce training may improve child outcomes. And so for all of these individual components, fundamental 4, it's really being able to also link these across different systems. So I think you'll see at the top, if you're looking at the unique identifier, there's a line linking the number 1, number 5, and number 7. So being able to link all of this information across, but then with fundamental 4, connecting it to K through 12 in order to answer those questions about how children are progressing over time. And then the governance fundamentals, 9 and 10, really apply across all of the fundamentals. And these really focus on the importance of having a governance structure and an entity in your state or locally that's dedicated to managing not only the collection but also the use of early childhood data. And that leads into fundamental number 10, so that this entity is also making sure that data collection policies are transparent to parents, to providers, to all users, and that the appropriate security and protections are being addressed at all levels of data collection and data use. So for our 2013 survey, we actually decided to focus on the fundamentals specific to child-level data collection, and then also information about whether or not states have an Ece Data Governance structure designated to support the development and use of coordinated systems. So you'll see in the first question we first ask about whether states have the ability to link child-level data across their early childhood programs or to other data systems such as K through 12, health, or social services. And that addresses the fundamentals for having a unique ID, collecting specific child-level information, and then number 4, as I mentioned, in being able to link that information. We also asked separately about whether or not states collected at a state level developmental screening and assessment data, and then also if they captured kindergarten entry data to examine children's developmental status and any service needs that they may have. And for that, we asked that across all of the programs, and I'll go into a little bit detail about that later. And then lastly, addressing fundamentals 9 and 10, we asked specifically about the functions and the authority of governance structures in their state. So before I go over the survey results a little bit more, I just want to explain the methodology for collecting the data for this survey. So this, we collected the information via an online survey. There was about 26 questions based on respondents' responses to the main questions. We had responses from all 50 states and the District of Columbia. So as I'm going through the presentation, for all of the main questions, this will be out of 51. And that what we did is that we tried to identify a main contact in each state that could respond to questions about all of the early childhood programs that we were including in our survey, which was Head Start, State Pre-K, Part C Early Intervention, IDEA Part B 619, subsidized child care through the Child Care Development Fund, and then also no, I think those are all of the 5 programs. And so what we did is we identified one main contact, and then we also provided information for all of the program contacts in the state for each of the programs that I had listed. And our main goal here was to, one, let the main contact know that it was important to contact other programs about the survey, but then also to let the other programs in the state know that this person has been designated as the main contact and respondent from their state. So if they wanted to give input on their program regarding the survey, they would contact that person. And so the respondents from the survey, the main contacts, about 31% were from Health, Social, and Human Services Department. About 25% of the respondents were from the Department of Education, and 20% were from state early childhood advisory councils. A lot of states had developed data subcommittees as part of their early learning councils, and so some of the work in coordinating across the programs and data collection had already happened. So in some cases, that person was identified as the appropriate contact. And then about 20% of respondents came from designated offices of early learning in that state. It took states about an hour of active time to complete the survey, but on average, usually the survey was completed over the course of about 3 days. So next, I just wanted to talk a little bit about how we defined linkages. The graphic here is showing all of the early care and education programs that were included as part of our survey. And the numbers underneath represent the annual number of children served based on the most recent data available, just to give you an idea of the scope. So we first asked states if they linked early childhood data across the ECE programs. And so to link across the programs, we define that as if a child was attending a state pre-kindergarten program and then maybe switched to a Head Start program in the middle of the year because the family had moved, would a program administrator be able to connect information about that child between those two programs? Or another way of looking at it is, would that program administrator be able to get an unduplicated count of children that were being served by publicly funded programs during that year? Or would that child be being counted separately in each of those programs? So you could know if a child was participating in a part-time preschool program while also receiving perhaps evening care through the subsidized child care program. So that's how we had defined for states when we were asking about if they were linking across their early childhood programs. We next asked if states were able to link to other state data systems, such as K through 12, health, and social services. And so by linking to K through 12, we were asking if a child's participation in different early learning settings and experiences could be examined in relationship to their success in the early elementary school grades. Similarly, for health and social services, whether or not they were able to connect if a child was receiving Medicare or maybe was part of the foster care system. So we were specifically asking at a child level whether or not they were able to connect this information. So now I'm just going to quickly go over the survey findings. So for our first question, asking whether or not states could link data across the 5 early childhood programs that we had identified, we found that Pennsylvania was the only state that indicated they had the capacity to link child-level data across all of the early care and education programs that we specified, as well as being able to link to their state K through 12 system. There were no states that were linking all of their programs to health and social services data systems. We found that states that did indicate they were linking data from at least one of the programs were more likely to say that they were linking with their K through 12 data systems compared to health or social services systems. And for those that were linking across their early childhood programs or linking with their K through 12 system, we asked specifically about which programs they were linking child-level data from. And what we found is that of those that were linking at least one program, states tended to be linking data from their pre-kindergarten program or from their preschool special education programs as compared to linking data from their Head Start or their subsidized child care programs. And this is consistent with what we'd heard from states before. A lot of states are leveraging their state longitudinal data systems that are being administered through their departments of education. And so in some cases, their state pre-kindergarten and their preschool special education data is being administered through their school districts or being directly entered in through their K through 12 systems. We found that over half of states were collecting some type of child development data in their systems, and a majority of states had a designated Ece Data Governance entity that was assigned to guide the development and the use of a coordinated data system. So that was either a single agency or multiple agencies that were working collaboratively to play this role. So next, I'm going to just go through and show you where states fell as far as the results on the survey. So this first graphic shows which states were linking child-level data across their early childhood program. So as I was saying before, whether or not, for example, they would be able to get an unduplicated count across their programs. You'll see the striped state in Pennsylvania was the only state that indicated they were linking across all of the ECE programs. The purple states designate those states that were linking across at least 2 programs. And then the blue indicates those states that were weren't currently linking child-level data, but were planning or in the process of implementing linkages across at least one of their programs. The dark purple indicates those states. Let me back up. The orange are those states that said they had the capacity but weren't currently linking their child-level data. And the purple indicates those that were not currently planning to link. So we had about 25 states that were linking data from at least one program, and then additional ones that were planning to link. You'll see here in looking at states that are linking to K through 12 that there's a lot more states that are linking at least one program. We had about 29 states, 30 states that were linking at least data from at least one early childhood program. And you'll see the blue again. You'll see a much larger that are doing some linking with K through 12, fewer that are planning, and a larger amount that's saying that they have the capacity but just are not currently linking. In focusing in on the Midwest and the Southwest regions, you'll see, let me go back to the previous slide, that you really see a mix of those that are planning and linking, and the same in the Southwest. And this is really similar to the trends that we saw nationally, which we saw as being really positive. Even if states weren't linking across all of the programs, they were actively linking data from at least one program or planning to. So as I mentioned before, for those that were linking across or to K through 12, we did ask specifically about what programs were being linked. So you'll see here in this bar, this indicates linkages. The purple bar indicates linkages across ECE databases, and then the light blue bar indicates the programs that are being linked to K through 12. So you'll see here that you see about 25 states are linking to K through 12, preschool special education, and then about 23 states are linking from their state pre-kindergarten. And just as a reference, this is of the 26 states that were linking some across ECE programs and the 30 states that were linking to K through 12. But what we found is that when focusing on federally, on Head Start and subsidized childcare, that there were fewer states that were linking and coordinating data from these programs. And so next, and I'm sorry, I want to be mindful for time because I think I'm running a little bit low, we also asked about whether they were linking with health data systems. And so in here what we found is that states were much more likely to be linking at least some data with their social services versus their health data systems. And you'll see here, up in the Midwest region, most are either planning, the blue, or linking at least one program. And for social services, there's a larger number that are either planning or linking to. And just anecdotally from responses from the survey, a lot of states that were coordinating with their social services or that were linking some information had indicated it was part of a process to coordinate eligibility processes as a beginning step. And then next, we had asked about the number of states that were collecting kindergarten readiness entry data and their screening and assessment data. And as I was saying before, over half the states were collecting at least screening assessment data for at least one program. So for this, one of the pieces that we want to do more investigation on is that this may indicate information that's being collected from one program. We're not sure if it's for all the programs within the particular state. So there's more detail that we're looking to get around this particular question. But I think what we're seeing that states have at least some screening and assessment data that they're able to capture at a statewide level. And then our last question was around ECE data governance. And as I was saying before, we really see this as a key component of an early childhood data system that really goes across all of the fundamentals, in that you have an entity that is responsible for not only helping to frame and develop the questions and the purpose around the early childhood data system, but is also responsible for addressing issues of sustainability, of security and privacy, and use of these data systems over the course of the life of these data systems. And so the purple indicates states that have an ECE data governance entity and states established in their state. And as I was saying before, in some cases this is one agency, and in other cases it's multiple agencies that are coordinating together around their early childhood data. We're looking to do another analysis of this information and put out a brief to provide some more detail exactly about how states are configuring their ECE governing bodies. The orange indicates those that are in a planning phase. And in this case, the light blue shows those states that do not currently have an ECE data governance entity assigned. And this doesn't necessarily mean that states are not still working on data linkages. They just have not formally developed a committee in order to coordinate this. And so one of the pieces that we'd asked about, so there were 32 states that indicated they had an ECE governance body in place. And so an entity that was responsible for overseeing the policies and procedures and use of their data system. And we wanted to get a sense of what the authority of these entities were, as well as what their primary functions were. And so at a minimum, most entities had the authority to make recommendations, and about 15 states had the authority to approve and monitor all policies related to their data systems work. The function of most of these entities was really to help facilitate sharing across state agencies, which is what we're hearing a lot of states are having the biggest challenge with, and is important to have stakeholders from different agencies to really address this issue as a group, help with strategic planning, data use, and then also linkages as well. So moving forward, ECDC, along with our partners and other national organizations, are really working to help states strengthen their linkages. The fact that so many states are planning or linking data from at least some programs is really encouraging, and I think we want to make sure to support states in this effort and this momentum. Also helping with states to expand their efforts to collect and link screening and assessment data. A lot of states have been successful in using this data to really identify early needs of children to make sure that appropriate interventions can be addressed as early as possible, as well as really making sure that the ECE governance structures and entities that are in place are really strengthened across the states in order to make sure that we can keep moving forward on these efforts and incorporating all of the programs that we've identified as part of our survey. So sorry I'm rushing through. Our full report, which includes additional information around the results, is available on our website, as well as the individual state profile. So if you're interested in how your state responded to all of the data that I've laid out here, you can go onto our website and see your individual state profile and responses. And that is available at our website, and you can always email me if you have any other questions. So I will pause there. I now think I'm about 5 minutes over.
Thank you, Ms. King. This is Ebony again speaking. I have one question from the audience, and one question is about the survey, and how can people find out who responded for their state?
So also on our website, we have a list of respondents. So we have listed the name, the email, and the agency, and the state of who responded for each individual state.
Wonderful. Another question we have Are you able to provide any examples from the states that are have more linkaging that are happening either across service agencies or with the K-12 system, and how they are using that linked data to answer any key policy questions?
So we actually had Pennsylvania highlighted on our webinar when we shared the results of our survey. And I use them as an example because there's a lot of examples to give. And plus they started implementing their system back in 2000. So they had initially started their system really with the goal of coordinating their subsidized data across their programs in order to get an accurate count of children needing care through their waiting list. Over time, they incorporated all of their data using unique identifiers through a joint venture between their Department of Public Welfare and Department of Education. And so as now, they're able to share information, now that they have these unique IDs, of how children are doing in third grade back with early childhood programs. And they've been able to link that with previous experiences, their previous early childhood experiences. We have some states that have been linking their pre-K data in a similar fashion to identify children that need additional services in other programs to facilitate transferring from one program to another as well. We have specific state examples in our full report, but primarily a lot of the examples that we had were states that were linking their pre-K data, and many were using their state longitudinal data systems to assign unique identifiers, but some also had unique identifiers that were being generated while the child was in an early childhood program and then connected with their K through 12, as well as using a matching system across their programs. I don't want to get very technical, but I think what we were finding from the survey is that some states were using multiple methods depending on the program to link that information. And I don't think we necessarily have enough information to say which procedure is more effective. I think it just depends on the state and how they're using that information.
Thank you, Ms. King. Yeah, that's very helpful. And we'll have a chance for more questions. So if you have questions with our next presenter, please just go ahead and type them in the comments and insight section of the pod at the bottom of the screen. Right now, I want to bring in Elliot Regenstein into a conversation where he'll be talking about sustaining data system development. Elliot Regenstein leads the OUNSA Prevention Fund, National Policy Consultation Practice, and coordinates its overall state and national policy efforts. He has extensive experience in working directly with states on policy development and is a frequent speaker and author on topics such as governance, data systems, and linkages between early learning and K-12. He also partners with the First 5 Years Fund to support policy changes at the federal level. Mr. Regenstein was one of the chief architects of Illinois' 2006 Preschool for All program while serving in the governor's office as Director of Education Reform. He also co-chaired the Illinois Early Learning Council from 2004 until April 2009 and currently serves as a member of the Council's Executive Committee, co-chairing its Data, Research, and Evaluation Committee. Mr. Regenstein holds a Bachelor's of Arts in History from Columbia University and a law degree from the University of Michigan. After law school, he served as a clerk on the Honorable Kenneth F. Ripple on the U.S. Courts of Appeal for the Seventh Circuit. Mr. Regenstein.
Well, thank you so much, and it's an honor to follow Carlise King, who does great work at the ECDC. As you can tell from my bio, I'm a policy person. I don't know if it's a good or bad sign that I was so intimidated by the webinar technology that I actually came across Chicago to be at the AIR office rather than try to figure it out in my own home office. But maybe that's a sign that, it takes all types to make this work. So what I'm going to talk about today is about the importance of sustaining involvement in the process of developing data systems. And I've been co-leading the Illinois data work for 5 years now, and have also in that time had the opportunity to work with other states. So I have a sense of from experience of what that takes, and really, at the very highest level, these stakeholder engagement processes only work if people feel like their input's really being heard and that hearing the input leads to results. So what I'm going to do is talk a little bit more about what that means in this particular context. The idea of hearing and acting on input, one of the things that I think is critical for states is making sure that the end users of a data system must be engaged in discussing what the system's actually going to do. If you go to most of your agency heads or, advocates or legislators and say, hey, let's do a huge time-consuming, expensive data project, they're not necessarily going to be excited about that, and yet all of those people have a long list of things that they really want to know that they can't know because the data system can't produce that information. So it's very important to start the conversation in the frame of, what is it you need to know for your policy work, for your practice? What is it that you don't know yet, as Carlise talked about, and that your end users have to be bought into the importance of producing that data? Otherwise, it's going to be very hard to sustain the effort. If you get that initial buy-in and initial recognition that this work is important, then what does it take to keep the process moving? We all know on this call that it is a multi-step process, that it's something that from when you get sort of an initial kickoff and people say, hey, this is worth doing, to when you actually are producing the data can be years. And so it's very important to lay out the steps as much as possible at the outset, and think of it not just as a set of technical steps, but really as a set of stakeholder engagement steps. What are the touch points you're going to need? When do you need to go to your larger early learning council? When do you need to go to agency heads in the legislature? Because if it turns into a technical project and not a policy project, then you're going to lose the attention of some of those folks who you need in order to keep energy sustained and ultimately provide the resources that will allow this to happen. So I like to think of it as multiple concentric circles. There is in any state going to be a relatively small group of people who are working at keeping the actual development of the data system going, but there's a much larger circle of people who need to be engaged to some degree in order to provide the sort of resource and strength that those folks in the middle need to keep the work going. And that's something that we've been, again, fortunate at in Illinois, where our larger ECE community doesn't want to be caught up in the details of data system development, but they do want to hear about it, and they do and they do want the occasional check-in, and they value it. And in fact, sometimes it's helpful to start talking about the technical details, because then they'll say, no, go back to work and tell us again in a few months. One of the things that's happened, one of the things that's really important to this is keeping the money flowing. And you hate to be sort of overly pragmatic about it, but that's really the reality, as all of you know. And there are often grants that allow you to advance portions of the work. But thinking about where is the next dollar coming from is critical, and we'll talk about that a little bit more at the end. But again, in states where this has worked, there has been either sort of grant support at the outset that was clearly large enough to support multiple years of work, and that's generally from the federal government, or there's enough of a commitment at the state level to ongoing resource where the ongoing state funds can be counted on enough that people will really continue to be invested year over year. And again, that's something where, because it implicates state budget processes, you need to have broader engagement so that legislators and advocates all understand the importance of keeping that work going and not just seeing that as a line item that can be zeroed out in favor of some other priority. So in Illinois, through a mix of federal, state, and philanthropic investment, we've been able to keep the work going in multiple stages. We started one of our first major data investments in the last decade was in ICAM, the Illinois Early Childhood Asset Map, which was a state-private partnership that shows demographic data about where kids are in Illinois and maps that against our early childhood resources. And that was originally commissioned by the state so that in a period where we were expanding our investment, we could be very intentional about where was that investment going to go to reach the communities with the greatest need. From that, we had some infrastructure in place to think about, investing more in our longitudinal data system. And in Illinois, we're one of the few states that invests significantly in birth to 3 data through our State Board of Education. So while Illinois, like a number of states, used longitudinal data funds in order to get state preschool for 3- and 4-year-olds into the longitudinal data, we were actually able to go even a step further, and now some infant toddler programs are also included in the longitudinal data system. And again, that's thanks to our choices with a federal grant. When the State Advisory Council startup grants came, our Early Learning Council allocated a portion of that money to